Mr. Scott. My name is Anthony. I'm from the Respiratory Care Department and I'm a respiratory care student. So let me first wash my hands. So what I am going to do here today, by the way, is I will be administering oxygen as what was being ordered by the doctor, and I already checked it in the patient's chart. So first and foremost is, would you mind if I'm going to stand beside you and I will do my patient assessment first, and at the same time I will check your ID band to ensure proper identification. Okay. So once I'm done taking up vital signs, I'm going to explain to the patient about the oxygen cylinder. So what I am bringing here is an oxygen. So you will notice the oxygen by its color, with the color green, and even with a label or sticker on it where you will notice oxygen. So I will explain some of the safety mechanisms of the oxygen. So this one is being put in a rack to ensure that the oxygen should be not tip off or accidentally falling down. And then I already put no smoking signage outside to ensure that some of the patients or even relatives of yours who will come visit you will notice some of the important thing, because with smoking it will lead to combustion and also prevent any sources of light. And then we will not use this, we will recap it. And then another thing is, please prohibit children from roaming around or even some relatives of yours to attempt to touch the auto tank. And then I think I'm good to administer it. So first is, I will have here a flow meter, so which is a PISS gauge. So before putting this one in the tank, I have to check the item if it is in good condition, ensure that the nylon washer is able to have a system leak-free system, or it is not rough yet. So before putting this one, I have to crack the cylinder first. So once I'm done cracking the cylinder, I'm going to put this one, ensure that it is inserted tight. Sure it is inserted properly and it is tight. And then the flow should be set first to 0. And then once it is tight already, twist the cylinder, and then you will notice the gauge to suddenly go up. And then because the doctor ordered to have a flow of 2 liters, we're going to set this one to 2, and then make sure that there's air coming out. And then because the doctor ordered a nasal cannula, we're going to put this, insert the proximal to this one, and then attach it to the patient. So because I already gave this to the patient, once it's not in use, and then we have to remove the device, turn off the flow first to prevent any wasting of the gas, and then make sure that the device should be put back in a safety container and put it in the side. And then another important, by the way, sir, is you'll notice the gauge to be in 1500. So to ensure how long the duration is, we have to compute the pressure of it with the tank factor, because it is an E cylinder, times 0.28 and divide it with the flow that was being given to you, which was 2 liters. And then when not in use, we have to crack again, turn off, and then make sure that the gauge should be back to 0. And then we have to either remove this one, the device, put it on the safe side so that the tank should be recapped. So we have to remove this one, put it on the side, and recap it, and the tank should be on the side. And then once I already administered to the patient the oxygen, or once he or she is done, I have to reassess, document it to the patient's chart, if what was my assessment is, if how was the patient once being given to the oxygen. remove the gloves if possible, and even wash my hands. So I think that's all.